Welcome to today's technical briefing on the COVID-19 vaccine rollout. Today we'll hear from a number of spokespeople from a number of federal departments and agencies. We'll start today with opening remarks from Dr. Howard Njoo from the Public Health Agency of Canada, followed by Arianne Reza from Public Services and Procurement Canada. Followed by Dr. Supriya Sharma from Health Canada, as well as Dr. Marc Berthiaume, as well from Health Canada. We will then turn to a question and answer session for about 30 minutes. Over to you, Dr. Njoo.
Okay, thank you very much, merci. Good morning, good afternoon. As we all know, vaccination is one of the world's greatest public health achievements. For over 50 years, vaccines have provided a cost-effective tool to help control and eliminate the spread of deadly diseases in Canada and abroad. Canada's vaccination programs and regulatory approval systems are among the best in the world and the envy of many. We have well-established systems to deliver vaccines to Canadians and need only to look to the rollout of seasonal influenza vaccines, measles and polio vaccines to understand how Canadians will benefit from leveraging and building on our existing infrastructure in a future COVID-19 vaccine campaign rollout, recognizing some of the unique aspects related to COVID-19. We're doing everything we can to give Canadians access to the safest, most effective COVID-19 vaccines in the world. Over the past several months, there has been a great deal of preparation taking place behind the scenes to ensure Canada is well positioned to obtain COVID-19 vaccines and, building on our well-established systems, provide access to every Canadian who wants one in 2021. This is the first in a series of regular weekly briefings on Canada's vaccine plan. Today's focus will be on procurement and Canada's regulatory process to approve vaccines for the Canadian marketplace. Future briefings will cover topics such as logistics, distribution, and allocation. Vaccine development is a highly complex and long process that typically takes years due to the extensive research required to ensure a safe and effective product for human use. COVID-19 vaccine efforts are taking advantage of the latest innovations and unprecedented global collaboration to accelerate the development of a COVID-19 vaccine. As of November 12, 2020, there are over 140 COVID-19 candidate vaccines in different stages of development by academia and industry globally, with 104 vaccines in clinical trials, including 75 vaccines in Phase 1 and/or 2, and 28 vaccines in Phase 3. Phase 3 clinical trials, which are designed to measure how well a vaccine will prevent COVID-19, have been registered in the UK, the US, Brazil, South Africa, Pakistan, Russia, and the UAE. As of October 25, 2020, the Government of Canada has secured access to 7 leading vaccine candidates, which my colleague, Ms. Reza from Public Services and Procurement Canada, will speak to. The development of a diverse portfolio of promising candidate technologies informed by expert advice from the Vaccine Task Force will mitigate the risk of vaccines failing to reach market. Of the 7 vaccine candidates with whom Canada has established agreements, 5 of these developers are in Phase 3, 1 is in Phase 2/3, and 1 is in Stage 1/2. The Government of Canada is working closely with the provinces and territories and our many public health partners to ensure there is a timely, fair, and well-coordinated rollout once 1 or more vaccines have been authorized for use by Health Canada. Dr. Sharma will be speaking in more detail to the regulatory process in Canada. As things stand now, we expect certain vaccines to become available in early 2021. However, it's important to note that the initial supply of these vaccines will be limited. In the meantime, the Government of Canada, provinces and territories, and other partners are working together to identify high-priority groups who will benefit the most from these vaccines. The National Advisory Committee on Immunization, or NACI, is an external advisory body that provides the Public Health Agency of Canada with independent, ongoing, and timely medical, scientific, and public health advice in response to questions from the Public Health Agency of Canada relating to immunization. On November 3rd, NACI released its preliminary guidance on key populations for early COVID-19 vaccination, outlining a recommended targeted vaccination program. NACI's preliminary guidance outlines a targeted vaccination program that achieves public health goals as efficiently, effectively, and equitably as possible, when vaccine supply is limited. Their recommendations will inform government decision-making around first vaccines once Canada has access to safe and effective COVID-19 vaccines, and will continue to evolve and be refined as further data and information become available. The key populations that NACI identified include those at high risk of severe illness and death from COVID-19, including advanced age and other high-risk conditions, those most likely to transmit COVID-19 to those at high risk of severe illness and death from COVID-19, and workers essential to maintaining the COVID-19 response, such as healthcare workers and caregivers in long-term care facilities. Those contributing to the maintenance of other essential services for the functioning of society, such as police and firefighters. Those living or working conditions that put them at elevated risk of infection and where infection could have disproportionate consequences, including Indigenous communities. We're also actively engaging with national Indigenous organizations to discuss the appropriate and respectful rollout in their communities. While the initial supply will be limited, I want to be clear that we will have sufficient vaccines such that every Canadian has the opportunity to be immunized. In a country as geographically large as ours, we can expect some logistical challenges ahead. To help anticipate and address any potential challenges, the Public Health Agency is working with the Canadian Armed Forces, whose personnel have been integral to our COVID-19 response since the onset of this pandemic. In addition, the National Emergency Strategic Stockpile, which has sites located across the country, has already acquired and begun to share with the provinces and territories necessary supplies such as millions of needles, syringes, and alcohol swabs, as well as freezers for vaccine storage. We also have a prepositioning mechanism at our disposal, which would allow us to import and store a promising vaccine in Canadian facilities prior to their market authorization in Canada. This would facilitate faster distribution of the vaccine to provinces and territories immediately upon approval. Until there's a safe, effective, and fully approved vaccine or vaccines which are widely available here in Canada, I want to remind all Canadians that we must continue to practice public health measures, including physical distancing, hand washing, and wearing a mask. With winter upon us, it's imperative that we strengthen our collective resolve and do everything within our individual capacity to safely navigate the weeks and months ahead as we wait for vaccines to become available. Through this pandemic, Canadians have come together to protect those most at risk, and we know everyone will continue to understand the need to protect our priority groups. Canadians will have each other's backs. Protecting the most vulnerable helps protect everyone. Our COVID-19 immunization response cannot be effective without the support and collaboration of our provinces, territories, Indigenous leaders, experts, manufacturers, and all Canadians. Our plan is rooted in core principles, which include science-driven decision-making, transparency, coherence and adaptability, fairness and equity, public involvement, and consistent reporting. Our goal is to enable as many Canadians as possible to be immunized as quickly as possible against COVID-19. While Canada's immunization response is large and multifaceted, we are in a strong position to take on this challenge. When a vaccine is ready, Canada will be ready. Thank you. Maintenant en français, bonjour à toutes et à tous. Comme nous le savons tous, la vaccination est l'une des plus grandes réalisations au monde sur le plan de la santé publique. Depuis plus de 50 ans, les vaccins constituent un outil rentable pour aider à contrôler et à éliminer la propagation des maladies mortelles au Canada et à l'étranger. Les programmes de vaccination et les systèmes d'approbation réglementaire du Canada figurent parmi les meilleurs au monde et font l'envie de nombreux pays. Nous disposons de systèmes bien établis pour distribuer des vaccins aux Canadiens. Il suffit de se pencher sur le déploiement des vaccins contre la grippe saisonnière, la rougeole et la poliomyélite pour comprendre à quel point les Canadiens bénéficieront de la mise à profit de notre infrastructure existante lors d'une future campagne de vaccination contre la COVID-19, compte tenu de certains aspects uniques liés à cette maladie. Nous mettons tout en œuvre pour offrir aux Canadiens un accès aux vaccins contre la COVID-19 qui sont les plus sûrs et les plus efficaces au monde. Au cours des derniers mois, des travaux majeurs de préparation ont été menés en coulisses pour faire en sorte que le Canada, soient bien placés pour obtenir des vaccins contre la COVID-19 et misons sur ces systèmes bien établis pour vacciner tous les Canadiens qui souhaiteront l'être en 2021. La présentation d'aujourd'hui est la première d'une série de séances d'information hebdomadaires sur le plan du Canada en matière de vaccination. Nous nous concentrons aujourd'hui sur l'approvisionnement et le processus réglementaire du Canada pour l'approbation des vaccins destinés au marché canadien. Les prochaines séances d'information porteront notamment sur la logistique, la distribution et l'attribution. La mise au point des vaccins est un long processus très complexe qui s'échelonne habituellement sur plusieurs années compte tenu des travaux de recherche approfondis nécessaires pour garantir un produit sûr et efficace pour les humains. Pour la vaccination contre la COVID-19, on tire profit des dernières innovations et d'une collaboration sans précédent à l'échelle mondiale pour accélérer la mise au point de vaccins. En date du 12 novembre 2020, il y avait plus de 140 candidats vaccins contre la COVID-19 à différents stades de mise en point par le milieu universitaire et l'industrie dans le monde. De ce nombre, 104 vaccins faisaient l'objet d'essais cliniques, ça veut dire 75 vaccins en phase 1 ou 2 et 28 vaccins en phase 3. Des essais cliniques de phase 3 qui servent à évaluer l'efficacité d'un vaccin à prévenir la COVID-19 ont été enregistrés au Royaume-Uni, aux États-Unis, au Brésil, en Afrique du Sud, au Pakistan, en Russie et aux Émirats arabes unis. En date du 25 octobre 2020, le Canada s'était assuré l'accès à 7 des principaux candidats vaccins, ce dont parlera mon collègue Mme Reza des Services publics et Approvisionnement Canada. La création d'un portefeuille diversifié de technologies candidates prometteuses, guidées par les conseils d'experts du groupe de travail sur les vaccins, permettra d'atténuer le risque que des vaccins ne soient pas mis en marché. Des 7 candidats vaccins pour lesquels le Canada conclut des ententes, 5 vaccins en sont à la phase 3, un vaccin en est aux phases 2 et 3 et un vaccin en est aux phases 1 et 2. Le gouvernement du Canada travaille en étroite collaboration avec les provinces, les territoires et ses nombreux partenaires en santé publique pour garantir une distribution équitable, coordonnée et rapide une fois que Santé Canada aura autorisé l'utilisation d'un ou de plusieurs vaccins. Le Dr Berthiaume présentera en détail le processus réglementaire du Canada. Dans l'état actuel des choses, nous nous attendons à ce que certains vaccins soient disponibles au début de 2021. Toutefois, il est important de souligner que le stock initial de ces vaccins sera limité. Entre-temps, le gouvernement du Canada, les provinces et les territoires, ainsi que d'autres partenaires, collaborent pour déterminer les groupes les plus prioritaires qui bénéficieront le plus de ce vaccin. Le Comité consultatif national de l'immunisation est un organe consultatif externe qui offre à l'Agence de la santé publique du Canada de façon constante et rapide des conseils médicaux, scientifiques et de santé publique sur les questions d'immunisation. Le 3 novembre, le Comité consultatif national de l'immunisation a publié ses lignes directrices préliminaires sur les populations clés à vacciner en priorité contre la COVID-19, dans lequel il a décrit un programme de vaccination ciblé. Dans ces lignes directrices préliminaires, le Comité consultatif national de l'immunisation décrit un programme de vaccination ciblé qui permet d'atteindre les objectifs de santé publique de manière aussi efficiente, efficace et équitable que possible dans un contexte où les stocks de vaccins sont limités. Ces recommandations guideront les décisions du gouvernement au sujet des premiers vaccins lorsque le Canada aurait accès à des produits sûrs et efficaces contre la COVID-19 et elles continueront d'évoluer et d'être peaufinées au fur et à mesure que des données et des renseignements deviennent accessibles. Parmi les segments clés identifiés par le comité, il y a les personnes susceptibles de contracter une grave maladie ou de mourir si elles contractent la COVID-19, y compris les personnes d'un âge avancé ou ou qui souffrent d'autres conditions graves. Deuxièmement, les personnes les plus susceptibles de transmettre la COVID-19 aux personnes qui présentent un risque élevé de tomber gravement malades ou de mourir de la COVID-19 et les travailleurs essentiels au maintien de l'intervention pour lutter contre la COVID-19. Les personnes qui contribuent au maintien d'autres services essentiels au fonctionnement de la société comme les policiers et les pompiers. Les personnes dont les conditions de vie ou de travail augmentent le risque d'infection et pour que l'infection pourrait avoir des conséquences disproportionnées, y compris les membres des communautés autochtones. Nous consultons aussi activement les organisations autochtones nationales pour discuter de la façon appropriée et respectueuse de lancer la campagne de vaccination dans leur communauté. Même si les stocks initiaux seront limités, je veux être clair, il y aura suffisamment de vaccins pour que chaque Canadien puisse être immunisé. Dans un pays aussi grand que le nôtre, nous pouvons nous attendre à ce qu'il y ait certains obstacles logistiques devant nous. Pour nous aider à prévoir et à surmonter tout obstacle possible, l'Agence de la santé publique du Canada travaille avec les forces armées canadiennes dont le personnel a joué un rôle essentiel dans la lutte contre la COVID-19 depuis les débuts de la pandémie. En outre, la Réserve nationale stratégique d'urgence, qui a des installations dans tout le pays, s'est déjà procuré le matériel nécessaire comme des millions d'aiguilles, de seringues et des tampons imbibés d'alcool, ainsi que des congélateurs pour le stockage de vaccins, et a commencé à le partager avec les provinces et les territoires. Nous disposons aussi d'un mécanisme de mise en place préalable qui nous permettra d'importer et d'entreposer un vaccin prometteur dans des installations canadiennes avant que sa mise en marché au pays soit approuvée, ce qui facilitera une distribution rapide du vaccin aux provinces et aux territoires immédiatement après l'approbation. Jusqu'à ce que des vaccins sûrs, efficaces et entièrement homologués soient largement disponibles ici au Canada, je vais rappeler à la population que nous devons continuer de respecter les mesures de santé publique, y compris l'éloignement physique, le lavage des mains et le port du masque. Comme l'hiver est à nos portes, il est impératif que nous réaffirmions notre détermination et que nous fassions tout ce qui est en notre pouvoir individuellement pour franchir en toute sûreté les semaines et les mois à venir, tandis que nous attendons que les vaccins soient disponibles. Tout au long de la pandémie, les Canadiens ont uni leurs forces pour protéger les personnes les plus vulnérables et nous savons que chacun continuera à comprendre la nécessité de protéger les groupes prioritaires. Les Canadiens seront solidaires. En protégeant les gens les plus vulnérables, c'est à la protection de tous que nous contribuons. Notre programme d'immunisation contre la COVID-19 ne peut être efficace sans le soutien et la collaboration des provinces, des territoires, des dirigeants autochtones, des experts, des fabricants et de toute la population canadienne. Notre plan s'appuie sur les principes fondamentaux, incluant la prise de décision fondée sur la science, la transparence, la cohérence et l'adaptabilité, l'équité et la justice, la participation du public et le signalement systématique. Notre objectif est de faire en sorte qu'autant des Canadiens que possible puissent être immunisés aussi rapidement que possible contre la COVID-19. Même si la campagne d'immunisation du Canada est vaste et complexe, nous sommes bien placés pour relever ce défi. Lorsqu'un vaccin sera prêt, le Canada le sera aussi. Merci.
We'll now turn over to Arianne Reza. Ms. Reza, over to you.
Merci. Bonjour et merci d'être ici aujourd'hui. L'approche du Canada sur l'acquisition de vaccins a été et continue d'être délibérée, stratégique et globale. L'objectif est de garantir l'accès à un portefeuille diversifié de vaccins, de sorte que le Canada soit bien placé lorsqu'un vaccin sûr et efficace sera prêt. Le Canada choisit ses vaccins sur les recommandations du groupe de travail sur les vaccins contre la COVID-19. qui est composé d'éminents spécialistes canadiens en matière de vaccins et d'immunologie et de chefs de file de l'industrie qui prodiguent des conseils d'ordre scientifique et technique au gouvernement sur les principaux candidats vaccins. Au nom de l'Agence de la santé publique du Canada, Service public et approvisionnement Canada, l'acheteur central du gouvernement, a négocié des ententes avec 7 fabricants de candidats vaccins de premier plan contre la COVID-19. Notre portefeuille de candidats vaccins comprend des plateformes technologiques nouvelles et inédites, ainsi que des technologies traditionnelles, autrement dit, une combinaison de techniques de pointe et de techniques éprouvées en matière de vaccins. Ces fabricants sont AstraZeneca, Sanofi et GlaxoSmithKline, Novavax, Johnson & Johnson, Pfizer, Medicago et Moderna. Afin d'avancer aussi rapidement que possible, la majorité de nos ententes ont débuté en tant qu'ententes de principe, conçues pour garantir un certain nombre de doses pendant les négociations des ententes d'approvisionnement anticipées. À ce jour, nous avons conclu des ententes définitives avec 5 de 7 fabricants et les négociations pour la mise en place d'ententes définitives avec Johnson & Johnson et Novavax vont bon train et sont sur le point d'aboutir. Au total, ces 7 ententes donnent au Canada l'accès à 194 millions de doses. Ces ententes donnent également au Canada la possibilité d'acheter jusqu'à 220 millions de doses supplémentaires. Cela signifie que nous avons la possibilité d'accéder à un total allant jusqu'à 414 millions de doses. Ainsi, le Canada dispose de la flexibilité nécessaire pour prendre des décisions futures quant à l'exercice de ces options. Bien entendu, tout candidat vaccin doit recevoir l'autorisation de Santé Canada avant de pouvoir être administré aux Canadiens et Canadiennes. Et mon collègue, la Dr Sharma, en parlera plus en détail un peu plus tard. Service public et approvisionnement Canada est en train de surveiller les calendriers de livraison et nous négocions en permanence avec les fabricants de vaccins afin d'obtenir des doses de vaccins le plus tôt possible pour la population canadienne. J'insiste sur le fait que ces calendriers varieront selon les candidats vaccins et dépendant entièrement de la progression des essais cliniques de la société, des résultats et des demandes ultérieures d'approbation réglementaire. Quoi qu'il en soit, les premières livraisons de vaccins contre la COVID-19 devraient commencer dans le premier trimestre de 2021. Parallèlement, nous travaillons d'arrache-pied pour garantir que les éléments essentiels nécessaires à l'administration efficace et rapide des vaccins, tels que les aiguilles, les seringues et les congélateurs, soient disponibles afin que le Canada soit prêt à agir dès que les fabricants expédieront les vaccins. Par exemple, le Canada a commencé à acheter des aiguilles et des seringues au cours de l'été. Nous en avons maintenant assez pour administrer près de 25 millions de doses de vaccins, sans compter les stocks supplémentaires qui arrivent chaque mois. Service public et approvisionnement Canada fait également l'acquisition, au nom de l'Agence de la santé publique du Canada, des services d'un fournisseur de soutien logistique pour appuyer la distribution de vaccins aux Canadiens et Canadiennes. Cela comprend des éléments tels que le transport et le stockage. Dans le cadre d'une invitation à se qualifier concurrentielle, le Canada a sélectionné 4 fournisseurs qui pourraient répondre à ces exigences. Et nous soumettons maintenant les travaux à leurs concurrents. Nous avons pour objectif de mettre en place un ou plusieurs contrats en décembre. En plus de ce travail à la demande de l'Agence de la santé publique du Canada, nous avons également acheté 26 congélateurs pouvant fonctionner à moins 80 degrés Celsius et 100 congélateurs pouvant fonctionner à moins 20 degrés Celsius, et ce pour stocker les vaccins. Le premier envoi de 34 congélateurs, dont quelques-uns de chaque type, a été déjà livré à l'Agence de la santé publique. Nous lancerons également une demande de proposition pour des congélateurs supplémentaires d'ici la fin de la semaine. Enfin, nous avons récemment publié une demande d'offre à commande pour de la glace sèche afin de soutenir la distribution et le stockage des doses de vaccins dans tout le pays. Cet appel d'offres se termine lundi et nous allons agir rapidement pour conclure des attentes. Pour terminer, je tiens à dire que le Service public et approvisionnement Canada continuera d'aider l'Agence de la santé publique du Canada à garantir l'accès aux vaccins et à veiller à ce que le Canada ait la capacité de stocker, de fournir et d'administrer ces vaccins. And now in English. Hello, and thank you for being here. Canada's approach to vaccine acquisition has been and continues to be deliberate, strategic, and comprehensive. The target is to ensure early access to a diverse portfolio of vaccines so that Canada is well positioned to receive doses as safe and effective vaccines are ready. Canada's vaccine selection is guided by the COVID-19 Vaccine Task Force, which is composed of leading Canadian vaccine and immunology experts and industry leaders providing scientific and technical advice to the government on major vaccine candidates. On behalf of the Public Health Agency of Canada, Public Services and Procurement Canada, the government's central purchaser, has negotiated agreements with the manufacturers of 7 promising COVID-19 vaccine candidates. Our portfolio of vaccine candidates includes new novel technology platforms as well as traditional tech. In other words, a combination of cutting-edge and tried-and-true vaccine science. They are AstraZeneca, Sanofi and GlaxoSmithKline, Novavax, Johnson & Johnson, Pfizer, Medicago, and Moderna. In order to progress as quickly as possible, most of our agreements began as agreements in principle, which enabled us to secure doses from vaccine suppliers while the details were being negotiated for the final advance purchase agreements. To date, we've reached final agreement with 5 of the 7, and negotiations towards final agreements with Johnson & Johnson and Novavax are progressing well and are being concluded. Altogether, these 7 agreements give Canada access to 194 million doses. These agreements also provide Canada with options to purchase up to 220 million additional doses. This means that we have the potential to access up to 414 million doses. This provides Canada with flexibility to make future decisions about whether to exercise options. Of course, any vaccine candidate must first receive Health Canada authorization before it can be administered to Canadians. And my colleague, Dr. Sharma, will speak more to that process a bit later. Public Services and Procurement Canada is continuously monitoring and negotiating delivery schedules with the manufacturers to get vaccine doses as early as possible for Canadians. It is important to underscore that timelines for delivery of doses vary from vaccine candidates and are dependent on the company's clinical trial timelines, results, and subsequent regulatory filings. In terms of timelines, first delivery of COVID-19 vaccines are anticipated to start in the first quarter of 2021. At the same time as we are finalizing these agreements to get Canadians access to safe and effective vaccines as they become available, Public Services and Procurement Canada is working to ensure that access to supply of the critical goods and services needed to deliver efficient and rapid administration, things like needles, syringes, and freezers, are on hand, so Canada is ready to go as soon as manufacturers are ready to ship vaccines. For instance, Canada initiated a procurement over the summer for needles and syringes, and we now have received enough supply to administer nearly 25 million doses of vaccine, with more supply arriving every month. Public Services and Procurement Canada is also procuring on behalf of the Public Health Agency of Canada the services of a logistic provider to support the effective distribution of vaccines to Canadians. This includes elements like transportation and storage. As part of a competitive procurement process, Canada selected 4 suppliers that have the capabilities to meet Canada's requirements, and we are now competing the work amongst them. We're aiming to have 1 or more contracts in place in December. In parallel with this work and at the request of the Public Health Agency, we've also purchased 26 freezers with minus 80 degrees Celsius capability and 100 freezers that can operate at minus 20 degrees Celsius to store vaccines. Our first shipment of 34 freezers, including both types, have already been delivered. We will also be issuing a request for proposals for additional freezers shortly. Finally, we recently launched a competitive procurement process to purchase dry ice to support the distribution and storage of vaccine doses across the country. This tender closes on Monday, and we will move quickly to put it in storage. In closing, Public Services and Procurement Canada will continue to support the Public Health Agency of Canada in securing early access to vaccines and ensuring that Canada has the capability to store, deliver, and administer those vaccines. Thank you.
Thank you, Ms. Reza. We'll turn over to Dr. Supriya Sharma.
Thank you. Thank you, Eric. My name is Supriya Sharma. I'm the Chief Medical Advisor at Health Canada, and I'll be speaking to you about the regulatory process today. We understand that we need to be nimble and agile while maintaining our standards for safety and efficacy and quality. While significant time and resources are being devoted to expediting the scientific review of COVID-19 vaccines, the decision on whether they will be authorized will ultimately depend on assessment of the data, including the complete information from clinical trials, which is still coming in. Health Canada has a rigorous scientific review system in place to ensure vaccines are safe and effective in preventing the disease they target. And we will only authorize a vaccine if its benefits clearly outweigh its risks. Under usual circumstances, Health Canada reviews vaccine submissions after all clinical studies are completed and the full study results are available. That timeline for the full review can take up to a year. However, recognizing the urgent need for COVID-19 health products, like vaccines, the Minister of Health signed an interim order introducing more flexibility to expedite the review and authorization of drugs and vaccines for COVID-19. For example, it allows Health Canada to accept rolling submissions for drugs and vaccines that have promising evidence and clinical trials underway. This means that we will accept and assess the information submitted by the manufacturer as it becomes available. This new process still involves reviewing all the necessary data, but it can shorten the time it takes for a new vaccine to be authorized once all the necessary data are available. Health Canada is conducting independent reviews of the vaccine candidates, with reviewers assessing the data in the context of the Canadian healthcare system. That doesn't mean we're doing it alone. From the moment we knew that vaccines were starting to be developed, we have worked with our international colleagues to align our standards of evidence and discuss the advances being made by the scientific teams working globally. Canada's requirements for vaccine approval under the interim order are comparable to those for an emergency use authorization in the United States and other pathways internationally put into place specifically for assessment of vaccines and treatments for public health emergencies. While developing a vaccine, scientists collect evidence to show that it's safe, effective, and manufactured to the highest quality. This evidence comes from the review of manufacturing processes and human clinical trials. Health Canada's reviewers thoroughly review the submission to confirm that there are no significant safety concerns, and they determine that the vaccine is able to prompt an adequate immune response in vaccinated people and shows that it can protect against disease, as well as determine from the safety and the efficacy review that the benefits outweigh the risks and ensure that the vaccines can be manufactured to high-quality standards. They review procedures for safety monitoring outlined by the manufacturer and any plans to minimize any identified risks. We've also dedicated more resources to review COVID-19 submissions. Reviewing a vaccine submission that consists of hundreds of thousands of pages of data takes on average 2,000 person-hours. Each vaccine review typically involves a team of 7 to 12 reviewers, and this is what our reviewers do day in and day out. Once a vaccine is in use, Canada has a vaccine safety monitoring system that involves healthcare professionals, the provinces and territories, the Public Health Agency of Canada, as well as Health Canada. And this is to alert public health authorities of any changing trends or unusual adverse events that weren't previously reported. These alerts trigger expert medical reviews, which are conducted on all serious adverse events to identify any safety concerns. This system is called the post-market surveillance system, and it's essential to ensure the continued quality, safety, and effectiveness of all vaccines that are being used in Canada. As my remarks come to a close, I just want to underscore that while we are working hard to give Canadians access to COVID-19 vaccines as quickly as possible, we will not compromise our safety, efficacy, and quality standards. Protecting the health and safety of Canadians is our top priority. Merci. Thank you.
Thank you, Dr. Sharma. Dr. Berthiaume, à vous la parole.
Bonjour, mon nom est Marc Berthiaume et je suis le directeur du Bureau des sciences médicales à Santé Canada. Nous sommes conscients qu'il nous faut faire preuve de rapidité et de souplesse, tout en maintenant nos normes en matière d'innocuité, d'efficacité et de qualité. Beaucoup de temps et d'énergie sont consacrés à l'accélération de l'examen scientifique des vaccins contre la COVID-19, mais au bout du compte, la décision de les autoriser ou non repose sur l'évaluation de données comme les résultats complets des essais cliniques qui continuent d'arriver. Le Canada dispose d'un système d'examen scientifique rigoureux pour veiller à ce que les vaccins soient sûrs et efficaces à prévenir les maladies qu'ils ciblent. Nous autoriserons un vaccin uniquement si les avantages l'emportent clairement sur les risques. Normalement, Santé Canada examine les présentations de vaccins une fois que toutes les études cliniques ont été terminées et que les résultats complets des études sont disponibles. Un examen complet peut prendre jusqu'à 1 an. Cependant, compte tenu du besoin urgent de produits de santé contre la COVID-19, comme des vaccins, la ministre de la Santé a signé un arrêté d'urgence qui donne plus de marge de manœuvre pour accélérer l'examen et l'homologation des médicaments et des vaccins contre la COVID-19. Cet arrêté d'urgence permet notamment à Santé Canada d'accepter des présentations en continu pour des médicaments et des vaccins qui ont donné des résultats prometteurs et qui font l'objet d'essais cliniques. Cela signifie que nous recevons et évaluons les renseignements fournis par le fabricant à mesure qu'ils deviennent disponibles. Ce nouveau processus implique toujours d'examiner toutes les données nécessaires, mais il réduit le temps d'homologation d'un vaccin une fois que toutes les données requises sont disponibles. Santé Canada effectue des examens indépendants des vaccins expérimentaux. Les évaluateurs analysent les données dans le contexte du système de santé canadien. Cela ne veut pas dire que nous travaillons seuls. Dès que nous avons su que des vaccins commençaient à être mis au point, nous avons travaillé avec nos collègues internationaux pour harmoniser nos normes concernant les données probantes et pour discuter des progrès réalisés par les équipes scientifiques travaillant à l'échelle mondiale. Les critères d'homologation des vaccins au Canada prévus dans l'arrêté d'urgence sont comparables aux critères d'autorisation d'utilisation d'urgence aux États-Unis et à d'autres mécanismes mis en place à l'étranger, spécialement pour l'évaluation de vaccins et de traitements en cas d'urgence de santé publique. Lorsque des scientifiques mettent au point un vaccin, ils recueillent des données pour montrer qu'il est sûr, efficace et fabriqué selon les normes de qualité les plus élevées. Ces données sont issues de l'examen des procédés de fabrication et des essais cliniques chez l'humain. Les évaluateurs de Santé Canada examinent les présentations pour s'assurer de l'absence de problèmes d'innocuité et établir que le vaccin peut produire une réponse immunitaire adéquate chez les personnes vaccinées et qu'il confère une protection contre la maladie. Établir à la lumière de l'examen de l'innocuité et de l'efficacité que les avantages l'emportent sur les inconvénients ou les risques et s'assurer que le vaccin peut être fabriqué selon des normes de qualité élevées. Finalement, examiner les procédures de surveillance et l'innocuité décrites par le fabricant et les plans visant à réduire au minimum tout risque constaté. Nous avons alloué de nouvelles ressources à l'examen des présentations liées à la COVID-19. L'examen d'une présentation de vaccin qui peut contenir des centaines de milliers de pages prend en moyenne 2000 heures personne. Chaque examen de vaccin nécessite normalement une équipe de 7 à 12 évaluateurs. C'est le travail qu'accomplissent nos évaluateurs jour après jour. Le Canada a mis en place un système de surveillance de l'innocuité des vaccins après leur mise en marché. Dans ce système, les professionnels de la santé, les provinces et territoires, l'Agence de la santé publique du Canada et Santé Canada avisent les autorités de la santé publique des changements de tendance et des événements indésirables inhabituels qui n'ont pas encore été signalés. À la suite de ces avis, des spécialistes mènent des évaluations médicales qui portent sur tous les événements indésirables graves pour identifier les problèmes d'innocuité. Ce système appelé surveillance post-commercialisation est essentiel pour assurer le maintien de la qualité, de l'innocuité et de l'efficacité de tous les vaccins qui sont utilisés au Canada. En terminant, j'aimerais souligner que, même si nous travaillons sans relâche pour offrir aux Canadiens des vaccins contre la COVID-19 le plus rapidement possible, aucun compromis ne sera fait sur les normes en matière de sûreté, d'innocuité et de qualité. La protection de la santé et de la sécurité des Canadiens demeure notre priorité absolue. Merci.
Merci, docteur. We will now open the phone line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking questions in the room, we ask that you make your way over to the freestanding mic. Over to you, operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser votre question. La première question, the first question is from Émilie Bergeron of Agence QMI. Please proceed, la parole est à vous.
Oui, bonjour. Dans vos déclarations d'ouverture, je pense que c'est Dr. Njoo qui a dit que ça va être possible de recevoir et de stocker des doses de vaccins au Canada avant que Santé Canada ait donné son feu vert? Est-ce que ça veut dire que, par exemple, si un vaccin a été approuvé aux États-Unis par la FDA, il va pouvoir commencer à arriver même si l'approbation de Santé Canada est toujours en attente?
Oui, merci pour la question. C'est Dr. Njoo. Oui, c'est exactement le cas. On a toujours, comme dit, la flexibilité de, comme dit, de recevoir les vaccins pour mettre en place en attendant si l'approbation n'était pas encore, comme le processus n'est pas encore terminé. Mais je vais passer la parole à Dr. Berthiaume pour élaborer encore. Merci.
Certainement. Alors, l'arrêté d'urgence qui a été adopté par la ministre de la Santé permet un prépositionnement des vaccins au Canada. Donc, ça permet, dans le fond, d'accepter, d'importer des vaccins au Canada avant qu'ils soient officiellement autorisés. Ce qui permet, en fait, qu'une fois qu'il y a une autorisation, il puisse avoir une distribution rapide. Donc, c'est une option qui existe dans l'arrêté d'urgence qui a été adopté là, au mois de septembre.
Maybe I can do it in English. So just to say that the provisions that we put in for the interim order allows for something we call pre-positioning. So currently, the way that the laws work is that you can't bring in a product into Canada unless it's authorized. But the interim order will allow companies to import those vaccines prior to Health Canada authorizing them. However, those vaccines would only be distributed and they would go through vaccination when Health Canada has done, after Health Canada has authorized it. Now, it's really only for vaccines for which we have advanced purchase agreements and that are currently under review. And the idea is that if there's anything that would potentially delay the distribution of those vaccines, that we want to avoid that. So we allow them to be brought into Canada ahead of time.
Thank you, Doctors. Émilie, question suivie?
Oui, merci. Juste pour être clair, c'est à partir de quel moment que l'arrivée de ces doses-là pourrait se faire? Est-ce que c'est nécessairement quand une autre autorisation a été donnée à l'étranger, comme la FDA que je mentionnais, ou ça peut se faire même avant ça? Puis aussi au niveau du temps de conservation des vaccins, c'est quoi votre marge de manœuvre?
Donc, pour répondre à votre question, l'arrêté d'urgence permet d'avoir, dans le fond, l'interprétation de vaccins avant leur approbation au Canada sans qu'il y ait un lien avec une approbation dans une autre juridiction. Donc, ce n'est pas un facteur limitant. Ceci dit, on s'attend à ce que l'autorisation, en tout cas des vaccins qui sont actuellement en revue, se fasse de façon relativement proche les unes des autres. Donc, on ne prévoit pas de grands délais entre l'approbation des médicaments. Fait que je ne pense pas que ce soit un facteur important en termes de limiter l'accès. Mais pour ce qui est de l'arrêté d'urgence, donc on peut importer ces médicaments-là, même s'ils n'ont pas encore été autorisés là, dans d'autres pays. Pour ce qui est de la durée de conservation, je n'ai pas de données spécifiques là-dessus. Je pense que ça va dépendre là, spécifiquement des produits. Ce sont des choses qu'on regarde actuellement, évidemment. Là, on sait que les différents vaccins, selon leur technologie, peuvent avoir différentes modalités de réfrigération. Mais pour ce qui est de la durée de la conservation, ça fait partie des choses que l'on analyse là, lors de la revue.
Merci, docteur. Opérateur, prochaine question.
Merci. Thank you. The next question is from Mia Rabson of the Canadian Press. Please proceed. Your line is open.
Yeah, good afternoon. I'm wondering if you could talk a little bit more about what this pre-positioning of vaccines would actually look like and what the shelf life is. My understanding is that vaccines can't sort of last forever. You can't produce them now and then they'll be around forever. So just wondering if you can talk about the logistics of what this would mean. Would it be all in Ottawa? Would they be sent to the provinces early? Walk me through a little bit more about the details of how that might work.
Sure. So this is Supriya Sharma. I'll start on that. So yeah, you're right. So the pre-positioning allows it to be imported into Canada. There aren't any specific specifications on where those need to be stored, but in general, they would be stored in a central location. Now, when we're looking at the first vaccines that are coming through, likely it would not be they would not be candidates for pre-positioning because it's likely that the authorization by Health Canada and the time that there would be very little time between the authorization and when those those vaccines would be ready and have a supply to be brought to Canada. But as we go forward, there may be situations where a company has supply and they have the amounts that they need to send to Canada. And so then that could be sent into Canada. Pending the Health Canada authorization, it would be kept in a central location. And then after the Health Canada authorization, it would then be distributed and then it would be proceeding to vaccination. On the issue of shelf life or expiration dates of the vaccine, that's one of the things that we look at when we do the regulatory review. So companies will provide data on the manufacturing of the vaccines themselves, and that includes how long the shelf life might be. So we're in the process of looking at that data right now, and we don't have those determinations for the 3 candidate vaccines that we're looking at right now at this point in time yet.
It's Dr. Njoo. Maybe I can just add to that. As I indicated in my opening remarks, this really is the first in a series of what we call regular weekly technical briefings, and the focus today is on the procurement, also on the sort of the regulatory approval process. And the question is a good one, but it gets a little bit into logistics and other areas, which I think we'll get into more detail and unpack as we have future briefings. Thank you.
Thank you, doctors. Mia, follow up?
Yeah, we're just trying to get ahead of ourselves, Dr. Njoo. I would also wonder if you could talk to me about the approvals or the finalization of agreements. The Ontario Health Minister said today that she wasn't aware that there were final agreements and that the vaccines might not actually be coming to Ontario as had been previously reported. But I believe I heard today that 5 of the 7 agreements are finalized. So I'm just wondering if someone can talk to what it means to have a final agreement. Is it absolutely guaranteed that those 5 are coming to Canada at some point?
It's Dr. Njoo. I think because you're talking about the sort of agreements and sort of some of the contractual or agreement issues, I'm going to pass it on to my colleague, Ms. Reza.
Thank you for the question. Yes, we actually have 7 agreements with the 7 different vaccine candidates. 5, as I indicated in my remarks, are firm and 2 are being finalized. The agreements are advanced purchase order that contractually outlines the number of doses, the notional delivery schedule, and our ability to exercise options. So I think that perhaps the question is mostly at the federal level that Canada does have firm agreements.
Thank you. Operator, next question.
Thank you. Merci. La question suivante est de Madame Hélène Buzetti du Devoir. La parole est à vous.
Oui, bonjour. Justement, je veux faire un suivi là-dessus. Dans chaque contrat qui a été signé, il y a un échéancier de livraison. Alors, j'aimerais savoir pour les 3 vaccins les plus prometteurs, là, AstraZeneca, Pfizer et Moderna, quels sont les échéanciers pour les 3 premiers mois de 2021? Pouvez-vous nous donner une idée du nombre de doses qui est promis dans ces contrats pour les 3 premiers mois de l'année?
Merci pour la question, c'est Dr. Njoo. Je vais passer la parole à Mme Reza encore. Merci.
Merci pour la question. Afin de protéger notre position de négociation et les renseignements commerciaux de nature délicate dans les contrats, on ne peut pas décrire en grand détail. Toutefois, sachez que nous négocions activement chaque jour les calendriers de livraison avec les fournisseurs, tels que vous avez mentionné dans votre question, avec l'intention d'obtenir des doses le plus rapidement possible. Il faut cependant savoir qu'elles soient livrées par lot et que la livraison s'échelonne sur quelques mois, c'est-à-dire dans le premier trimestre de 2021, et que les lots deviennent de plus en plus gros à mesure que la production prend son air d'aller. Merci.
Question suivie.
Oui, alors vous dites qu'on est encore en train de négocier. Alors pour encore une fois les 3 contrats, les 3 compagnies qui sont les plus prometteuses là, est-ce qu'il y a un échéancier ferme? Me semble-t-il que c'est la question que tout le pays se demande. Me semble que vous épargneriez bien des mots de tête si vous nous en disiez un petit peu plus là-dessus. Merci.
Merci encore pour la question. En ce qui concerne les premières livraisons théoriques de doses, il est important de comprendre que les vaccins visés par les 7 accords d'achat anticipé se trouvent tous à des différentes phases d'essais cliniques et de processus d'approbation réglementaire connexes. Alors, à l'instant, ce qu'on trouve dans les accords et les attentes est ce qu'on planifie. Et on travaille d'une façon en étroite collaboration avec les fournisseurs pour prévoyer des livraisons détaillées. Cependant, il y a beaucoup de complexité dans leur chaîne, où ils sont dans leur essai clinique, quand est-ce qu'ils vont soumettre leurs applications pour des règlements. Tout ça donne plus de détails et plus d'informations quand on peut avoir les livraisons.
Merci, Madame Reza. We'll now turn over in the room. First question.
Hi, Marika Walsh with the Globe and Mail. On the pre-positioning, it was my understanding that Minister Anand has previously said that the companies would not be exporting to Canada until Health Canada has approved the vaccine. Are you saying that's not the case, or are you saying Canada is ready, but the companies haven't actually agreed to export the vaccines until Health Canada approves them?
So what we're saying is that there is a provision to allow for pre-positioning. So the legal barriers that are normally there about bringing in a vaccine that's not authorized yet into the country have been removed because we put that into the interim order. So that's the issue. For a vaccine then to be pre-positioned, a company would have to have vaccine, that's the most important thing, would have to have supply, and then sufficient supply that they could send to Canada and then store in a location before it would be distributed, and that would be an advantage. Now, especially when we're talking about the first vaccines that are under review that are the mRNA vaccines, they also have very rigorous storage conditions and the cold chain. So those would likely not be great candidates for pre-positioning because you'd actually have to maintain all of those requirements in those storage facilities as well. So it's unlikely that it will be used for the first vaccines, but as we move forward, there may be companies that have supply that would like to avail themselves of this possibility.
And there seems to be some confusion or questions around what happened between August and now. In the spring and the summer, the government said that the NRC facility that already exists would be available to produce small amounts of doses of vaccines, 250,000 per month by November, with the idea that that would go to the vulnerable populations or populations most in need. So what happened that is now not on the table?
It's Dr. Njoo, maybe I can start to, and when we're talking about the issues or bio manufacturing facilities, I think it's important to note that the first two most promising vaccine candidates, as Dr. Sharma has indicated, it's a novel technology. It's never been done in mRNA, type of technology, and so because of that, there really isn't a manufacturing capacity throughout the world. It's very limited, obviously, just the companies. It could be, but the thing is, you see, this is happening in real time. Not to get into the details, you can see that AstraZeneca, I know, put out some news in terms of some promising results, but it just in the last few days, we've now seen that the actual quality or the actual clinical data is being more heavily scrutinized. So I think the lesson, I think, for all of us, I think, is that we need to do our due diligence. You can see things in the press. Companies may release sort of preliminary information, but I think where it really counts is the actual data that they actually submit to our regulatory colleagues in terms of having a thorough analysis of the data and then seeing where it goes in terms of the approval process.
Thank you, Doctor. Next question, CTV.
Glenn McGregor, CTV News. Question for Dr. Sharma. The U.S. FDA is expected on December 10th to make a decision about the Pfizer candidate, and I'm wondering where that application is in Canada comparatively, and how quickly do you expect we could get a decision from Health Canada on approval? What is the earliest date that any of these first three candidates could conceivably be approved?
So with respect to the three candidate vaccines that we have under review, Pfizer's one of them. It's the one that's most advanced in the review, and we're actually working very closely with our colleagues in both the US FDA as well as the European Medicines Agency. So we're basically looking at the same data packages. We have very similar authorization pathways that are available for public health emergencies, and the way that the reviews are progressing is that we're expecting to make a final decision on the vaccines around the same time as both the US FDA and the European Medicines Agency. Now that's yeah, I mean, I think it really depends on it's of course, it's all based on the science and the data, but the way that the review is going currently, we're still expecting some data to come in, but we're on track to make decisions in similar timelines.
A question for Ms. Reza from the procurement side. We're wondering what the contracts with these vaccine manufacturers say about delivery once approval is granted. Are there any conditions in there about when and how much of our initial orders have to be delivered within a certain period of time? And we just heard from Dr. Sharma that approval could theoretically come in around the same time as the FDA in mid-December. When would Pfizer, for example, be required to make deliveries under the contract we have with them into Canada?
Thank you for the question. So I think it's important to just take a step back and look at this against the backdrop of immense global demand. Canada's been able to secure a strong portfolio of candidates, and we have worked with each of the vaccine manufacturers to, through vaccine engagement, to actually secure the most early access doses that we could possibly do that. To your specific question, we've talked to vaccine manufacturers, and they assure us that the minute regulatory approval comes through, they will be ready to go quite quickly afterwards. And so we're working on that basis that the supply and the initial shipments will, of course, be ramping up as their supply chains come on, but we don't anticipate any lag time.
It's Dr. Njoo. I apologize. Going back to Ms. Walsh's questions about the biomanufacturing facilities and so on, I forgot that we do have colleagues from ICET online, so I just wanted to give them an opportunity if they would like to expand or give any additional points in response to Ms. Walsh's question.
Well, sure. Thanks. This is Cheryl Grunoweg from ICET. I think that was well answered. The only other consideration I would add is that building out biomanufacturing capacity is extremely complex, and we are working at incredible speeds, unprecedented in the face of COVID. And so it's a constantly evolving environment, and so there are often shifting sands. And so what we're trying to do is make sure that we continue to press for the best outcomes possible, including those working extremely diligently at the NRC, trying to put in place capacity to help the Canadian COVID response effort.
Thank you. Next question in the room.
Hi there, it's David Cochran with the CBC. Dr. Njoo, I want to pick up on your question where you said that vaccinations could start early in the new year, but supplies will be limited. When you say limited, how limited are you talking? Is it a limit of the 6 million doses number by the end of March that we've heard reported publicly? Like, what percentage of the Canadian population can we anticipate might be vaccinated or start being vaccinated by the end of the first quarter?
Thank you for the question. Yes, exactly. What's obviously the figure that's now out in public is the 6 million doses anticipated if the two most promising vaccine candidates, the ones from Pfizer and Moderna, obviously are approved and are ready, obviously, for shipping and delivery to Canada. So at the present time, yes, if we're looking at 6 million doses, and it's sort of a two-dose schedule, we're looking at a population of about 3 million Canadians being sort of at the beginning to be vaccinated. Further, I know the next question is that, okay, so who would that be? And that's where we get into the recommendations from NACI and so on in terms of what would be the priority groups. And we're having active discussions, obviously, with our counterparts in the provinces and territories, are continuing to consult with the experts in terms of doing it, I would say, in the typical Canadian way. You know, it's all about vulnerable populations, but also trying to be equitable and covering a large country. En français, OK. C'est quoi le... Excuse. Ah oui, c'est sûr. Ah oui, actuellement, on est en train de l'approbation, c'est peut-être plus avancé pour les deux vaccins candidats les plus prometteurs, c'est de Pfizer et de Moderna. Et on attend, jusqu'à date, peut-être on va recevoir peut-être 6 millions de doses des deux compagnies. Si ce sont approuvés avec 6 millions de doses, et ça prend 2 doses pour chaque personne, ça veut dire qu'on est prêt peut-être à vacciner 3 millions Canadiens en recevant les vaccins. C'est sûr qu'au début, il faut prioriser les populations. On a déjà des recommandations de notre comité consultatif national d'immunisation Je pense qu'on continue avec nos discussions avec nos homologues des provinces et territoires, aussi des experts pour nous donner les meilleures recommandations pour comment il faut vacciner les personnes, parce que c'est un grand pays. Il y a beaucoup des aspects qu'il faut considérer. Merci.
So my follow-up, Dr. Njoo, is if we're going to have enough for 3 million people to be vaccinated by the end of March, or at least have their first needle, assuming approvals and deliveries go as planned, you've also said that you expect to have the vast majority of Canadians immunized by the end of this year. So does that mean we should anticipate a significant ramp up of vaccination throughout the spring and the summer? I know you don't want to publicly disclose deliveries because of contract sensitivities, but based on what you said about when can you expect the population to get the shot in the arm, should we expect a big ramp up in the spring and the summer and have the majority of the Canadian population done by the start of the next school year?
Well, certainly, when I indicated that earlier, it was an optimistic projection because I think certainly all indications are that the two vaccines from Pfizer, Moderna, the results of their phase 3 clinical trials are looking very good. Obviously, our colleagues at Health Canada will have to look at the data in the Canadian context, and hopefully once that gets approved, we'll get that initial batch. And as we move on throughout the year, we certainly anticipate getting the rest of our doses from those two companies, obviously according to the contracts we have in place at this point, their advanced purchase agreements. What I was also looking at is the fact that we actually have advanced purchase agreements with 7 vaccine candidates in total. And certainly the initial results of trials or what phase they're in are also looking promising. So with, I think, an optimistic eye, we're also anticipating that it won't just be those 2 vaccines at the beginning all throughout the year, but they will be bringing other vaccines, or as they say, online as well as being a part of a suite of vaccines in which we'll be able to offer vaccination to Canadians. So that, I think, is what we're looking towards. And some of those, let's say, later vaccines, if they do become approved and are ready for use in Canada, some of the, I think, initial logistical challenges, which we discussed earlier about Pfizer, Moderna, wouldn't be the same. They would be more like I would say the traditional vaccines in terms of the cold chain, and certainly with our well-established systems in the provinces and territories for vaccination, I think they would, be able to be rolled out in a much easier fashion. If everything goes according to plan, but as I say, there's always lots of moving parts, and certainly, as you say, you plan for all contingencies, and we'll make adjustments as we go along as necessary.
Thank you, Doctor. I will now move back to the phone for another round of questions. Operator, over to you.
Thank you. Merci. La prochaine question est de Mélanie Marquis de la Presse. La parole est à vous.
Merci. J'aimerais parler des congélateurs, comprendre un peu comment ça fonctionne. Où seront installés ces congélateurs-là? Est-ce qu'il y aura, par exemple, une centrale de congélateurs proche de chaque grand aéroport du pays? Comment ça fonctionne exactement?
Merci, c'est Dr. Njoo. Je peux aussi passer la parole à ma collègue, Mme Reza, mais je pense que la question, c'est vraiment ciblé sur la logistique. Comme j'avais constaté au début de la séance ici, on va avoir des autres séances d'information, peut-être plus ciblées sur la logistique. C'est sûr, on a déjà acheté, on a déjà eu, les livraisons des plusieurs congélateurs, mais les détails pour où est-ce qu'on va se placer les congélateurs, tout ça, je pense que c'est quelque chose, on peut donner plus de détails à une séance plus tard. Mais peut-être, Mme Reza, est-ce que vous voulez ajouter quelque chose?
Merci. Non, tout à fait, vous avez raison. Seulement pour noter que tous les congélateurs achetés seront confiés aux provinces et aux territoires en appui à la distribution du vaccin. Alors, l'Agence de la santé publique va travailler étroitement avec les provinces et territoires pour décider où les congélateurs vont être localisés.
Merci beaucoup. Prochaine question?
Oui, un suivi par rapport à... Si vous pouviez juste ventiler le processus, le nombre de personnes qui vont être vaccinées pour les 3 premiers mois de 2021. Vous avez parlé, je sais, de 3 millions d'ici la fin mars, mais combien dès le mois de janvier, combien en février, combien en mars?
Merci pour la question. C'est Dr. Njoo encore. Ça, c'est les détails, je pense. On est en train de discuter encore avec nos homologues des provinces et territoires. C'est un enjeu actuel. Je pense que on peut, comme dit, aller à l'avance trop vite parce qu'on n'a même pas eu l'approbation des 2 vaccins candidats prometteurs, c'est Pfizer et Moderna. Si tout va bien, avec l'approbation, on est en train de peut-être recevoir les 6 millions de doses des 2 compagnies au début de l'année prochaine, dans les peut-être deux premiers mois de janvier-février, mais ce sont des détails encore à discuter aussi avec la compagnie, avec nos homologues des provinces et territoires. Actuellement, on ne peut pas donner, comme on dit, un horaire exact. C'est beaucoup de détails comme on dit, à discuter encore avec plusieurs intervenants. Merci.
Merci, Doctor. Operator, next question.
Thank you. Merci. The next question is from David George Koch of BNN Bloomberg. Please proceed.
Yeah, hi there. Most of my questions have been actually answered already, but I'm just calling for a quick fact check, given the fact that a lot of numbers regarding doses that Canada has secured have been kind of thrown quite a bit. So this 194 million and 220 million additional on option, are those up-to-date figures that the government is releasing today? Like, because I've heard various numbers elsewhere. I'm just trying to fact check that.
Thank you for the questions, Dr. Njoo. I will pass that question on to my colleague, Ms. Reza from Procurement.
Yes, thanks for the question. Just to confirm, we have a total of 414 million doses. 196 million of them are firm with options for the, 194 million are firm with options to provide 220 million additional doses. That gets us to the total of 414 million doses.
And just to confirm that 194 million number, that's a new figure that you guys are committing to.
Well, the total number is 414 million doses in total. And we've just tried to demonstrate what is firm and what is the flexibility for Canada to option up to 220 million additional doses.
Okay. And just my last follow-up question here is, in regards to the whole logistics and shipping and procurement aspect of everything, what would you say has been the most challenging aspect of it? Is it securing the ultra-cold freezers for the 2 mRNA vaccines, or is there additional challenges that you're currently trying to figure out? Like, what is the most challenging thing you're trying to figure out right now?
From a procurement perspective, it's making sure that the requirements of the Public Health Agency and by extension the provinces and territories are well identified and that we have procured all the various moving pieces that we need to ensure the safe and effective vaccine administration of the vaccine so that we're ready to go when that first delivery hits the shores of Canada.
Thank you, Ms. Reza. Operator, next question.
Thank you. The next question is from Alison Martel of Reuters. Please proceed.
Thank you. Dr. Sharma, when and if Health Canada has approved a vaccine that is 90% or more effective, what kind of standards should we expect you to hold subsequent applications to? Is there any point where that 50% efficacy standard that you've communicated might rise?
Sure. So the 50% efficacy standard was something that's referenced in our guidance documents in terms of requirements for vaccine submissions. But again, that's just in guidance. So it allows the companies to put together their development plans. Certainly when we look at vaccine authorization, we really look at them individually. And ultimately, we look at the different packages of data that we look at, and overall it has to be that the benefits outweigh the risks. And for vaccines, it's really important to remember that they're not like chemotherapy agents that are given to patients with cancer, and so then you accept a certain level of serious adverse reaction like infections or your hair falling out. These are given to healthy people. So we really are looking at all of that information up front, and that's where the safety data comes in very early in the development process, and then we're looking at the efficacy. So there's really no magic number in terms of efficacy. Certainly, we're encouraged by the data that we're seeing in some of the vaccine candidates of 90% and above, but there's no specific target that we would be looking at. We really look at each individual vaccine submission as an independent assessment.
Follow up?
Thanks. I know that when you're evaluating drugs, there's often some comparison to what is already on the market. Is there anything like that for vaccines, or is everything sort of a fresh consideration?
Right. So for the vaccines, because there really isn't something to compare it to currently, we're obviously dealing with COVID-19. It's a new disease. We don't necessarily have treatments or therapies that are standard of care at this point in time. So the studies are really designed to look at the vaccine versus placebo, or somebody not getting the vaccine. So those are the ways that at least the initial studies have been set up.
Thank you. We will turn back to the room. Prochaine question, Juliane.
Juliane Lapointe de Radio-Canada. Docteur Njoo, vous en avez un peu parlé déjà en anglais, mais quand vous dites qu'on a espoir que toute la population va finir par être vaccinée éventuellement, ça ressemble à quoi un peu l'échéancier? Et est-ce que vous êtes conscient qu'il risque d'y avoir quand même pas mal d'anxiété du côté de la population qui va devoir patienter plusieurs mois avant d'obtenir son vaccin?
Merci pour la question. Moi, je pense que il faut toujours rester optimiste. Et avec les 2 vaccins candidats prometteurs, le Pfizer et Moderna, si tout va bien avec l'approbation, on va recevoir les 6 millions de doses au début. Et c'est sûr, on attend après aussi des autres doses on va recevoir des 2 compagnies. Mais avec les 5 autres candidats, si tout va bien avec les autres vaccins, on peut avoir, avec l'approbation, aussi, comme il dit, toute une sélection des vaccins. Et c'est aussi peut-être une bonne nouvelle que les autres vaccins seront, comment dire, plus faciles, si on parle de l'aspect de logistique, pour vacciner la population, parce qu'on n'a pas besoin de garder très froid, gelé comme le vaccin de Pfizer et Moderna. Moi, je pense aussi, pour la population qui peut-être s'inquiète, je pense que si on regarde c'est quoi les populations prioritaires, si on protège on va commencer avec la vaccination des populations prioritaires, c'est aussi, ça va protéger tout le monde. Parce que si on commence à vacciner les travailleurs de soins de santé, les médecins, les infirmiers, ils seront moins capables de transmettre l'infection aux autres. Donc, je pense que les Canadiens, en général, en principe, comprennent que oui, si on protège les populations les plus vulnérables et aussi les travailleurs essentiels, ça va aider tout le monde. Et tout le monde, je pense que si on est en bonne santé, c'est très important de toujours continuer à pratiquer les bonnes pratiques de santé publique. Et oui, les vaccins vont arriver pour tout le monde.
On a quand même vu au début de la pandémie que les gens perdent un peu leur côté rationnel dans ces moments de crise. On a vu les gens se ruer vers le papier de toilette. Quand il va être question d'un vaccin, donc de la vie des gens, est-ce que vous croyez que les gens vont réellement attendre patiemment, assis dans leur salon, que ce soit à leur tour? Est-ce qu'il ne va pas falloir qu'il y ait une grande campagne de communication, de sensibilisation auprès de la population pour éviter qu'il y ait des débordements?
Oui, c'est sûr. Et c'est très important. On est en train de faire, comme on dit, une campagne pour sensibiliser, pour éduquer. C'était très important pour donner beaucoup de renseignements, d'informations, pour être transparent aussi, pour bien communiquer avec les Canadiens et Canadiennes. Mais de l'autre côté, moi, j'ai beaucoup de confiance, comme les Canadiens. On est en général, je pense, patient. On est toujours, comme on dit, c'est quoi le mot, prudent. Et je pense que ça fait partie de notre caractère canadien. Ça, c'est mon avis. Je pense que oui, il y a toujours peut-être des petits défis, mais je pense qu'en général, on est toujours prêt à réagir avec n'importe quelle éventualité. Et si quelque chose arrive, on va réagir.
Thank you. We are getting really tight on time, so one question each, no follow-up.
Glenn McGregor from CTV News again. I'm a little confused about the timeline because you've given us some new information here about the likelihood that Health Canada would approve around the same time as the U.S. and Europe. The U.S. Health Secretary has said that he expects to get immunizations within 48 hours of approval by the FDA, so that's December 11th, December 12th. And Ms. Reza said once we've granted approval that she's expecting deliveries very quickly. Why then is everything looking towards January, February, more likely March? Is there a possibility that we could have vaccines approved, ready to go, first immunization starting sometime before the end of the year?
So maybe it's Supriya Sharma. I'll start first and then hand over to Dr. Njoo. So I mean, there's multiple things happening at the same time. So Health Canada, on the regulatory side, we're doing our review. The companies that have already finished their clinical trials are working to do their manufacturing. And the really complicated part of the vaccine manufacturing process is when they're doing that scale up, and they're doing that now. So there's often issues that come up during that scale up time. And then it's the matter of, what their volumes are going to be and which volumes are going to which country. So all of that is being determined as we speak. And I think it's really challenging for anyone, regardless of where they are in the world, to commit to the exact dates, because as we said, all of that's happening at the same time. So we're talking about January in terms of getting our first shipments in. If everything goes well and if it goes smoothly, they might be earlier. If there are hiccups or something else happens in the manufacturing process or the distribution process, it may be a bit later. And that's just why we're having, it's really difficult to kind of pinpoint those dates. And for people that are saying specific dates, I think that's great that they've got the confidence in those numbers. But from what we're seeing, there really are a lot of moving parts. We don't want to set up expectations that we may not be able to meet. But at the same time, we're working flat out across. I mean, we've got obviously Health Canada, FAC, our colleagues in PSPC and ISET all working together. But it also has to be in that environment where the provinces and territories have to be ready to receive those shipments and to go out and do those vaccinations. And those conversations are happening as well. So that's why we're saying, it's looking like we'll get to our regulatory review and our decision, which is a very key point in this whole process, around the same time as the other regulators. And then we're going to have to figure out all of those shipments. If any one country got their full allotment of vaccine all at the same time, they would not be able to distribute that, right? So we're just looking at what we can get in. As Dr. Njoo has said, we're looking at the numbers that we'll get in. Initially, get the priority groups vaccinated, and then see what else is coming down the pike, which may be more of these vaccines, which we think, but it also could be other vaccines that come in as well. So that's why it's just complicated to be very specific. But I think in the general timelines of authorizations around December, and then getting their shipments in January and getting those moving in January are sort of the best we have to offer at this point in time.
On that, I just wanted to clarify I understand there's a lot of moving parts, but where the certainty and expectations are, because at Health Committee last week, Ian Stewart said that we have contracts that request the 6 million vaccines by the end of March. So if Health Canada approves the Moderna and Pfizer vaccines, are we guaranteed 6 million doses by the end of March of those two combined? Or is that just the best hope and it could actually be later? Can you just clarify if the 6 million is guaranteed by the end of March or not?
So I'll just talk about the authorization piece, and then I'll turn it over. So in the authorization itself, it really just authorizes the vaccine. And again, with all the caveats of making sure that we are at the authorization, we're talking about our final decision. It doesn't talk in the Health Canada authorization about quantities. It's just, is that vaccine safe, efficacious, high quality? Can we scale it up? Are there quality assurance measures in place? And do the benefits outweigh the risk? So that's that piece. And then I'll turn it over to Dr. Njoo and potentially to colleagues from PSPC on the contracts.
Yeah, thank you. So in terms of the actual, you could say, be it the contracts and actually the delivery of the doses, I'm going to pass it on to my colleague, Ms. Reza, to answer that. And maybe I'll get back to the other point. One of the things that was asked, I think, about, the rollout, when are people going to be vaccinated? People in the U.S. might be vaccinated at a certain point in time. I would say that those details, I think we'll be having, obviously, additional technical briefings, including logistics. One of the things I will point out now, just for everyone to think about, is that, look at the United States, the geography. Look at the geography of Canada, and look at the months, January, February, March. I don't think I have to tell you what season that is in Canada. And so I think that's something else that's another factor that we need to keep in mind as well. So with that, I'll leave it at that and pass it on to my colleague, Ms. Reza.
Thank you. As it relates to the doses and the first notional deliveries and what the contracts guarantee and how best to proceed, really, I think that where we're at is that we work every day with the vaccine manufacturers to firm up the delivery schedule. We are focused on, of our portfolio of 7, 3 have had very good success. They're now looking at their regulatory submissions. They're now submitting to regulatory bodies. We've just had lots of discussions around regulatory approval. We continue to negotiate with the vaccine candidates, and we're looking at early Q1 for those deliveries.
Thank you, thank you, Ms. Reza. C'est ce qui met fin à notre briefing technique pour aujourd'hui. That will be all for today's technical briefing. Thank you.